Patient presented with irreversible pulpitis number 31. I was initially hopeful for the treatment, but found a crack into the root as I was instrumenting. Upon entry, the coronal pulp was necrotic, but there was tissue in all of the canals. This case was unique because I instrumented this case with V-tapers to 35 in the mesials and to 40 in the distals, to within a millimeter of the apex, 2006 to full length. And then I spent considerable time with hand files, pre-bent 15s and 25s, just trying to feel all the walls and trying to pick all the walls of tissue, free of tissue. And then I ran GenoWave Clean Flow, packed the temporary, and no calcium hydroxide, and then the patient had the tooth extracted the next day.
I received the tooth from Dr. Cito in formalin, and we took some pictures of it. It looked to be intact. I did not see any obvious fractures. That's the business end of the root. There did not appear to be any areas around the apices. We did stain it and did detect kind of a fracture off of the composite restoration in the usual place that did not continue down the root. And occlusally, there weren't any real obvious fractures. I sectioned the tooth axially right below the bifurcation of the root, and then we split the root into a mesial part and a distal part, and then imaged those radiographically separately from the mesial direction. Then we decided to split the tooth sagittally, each separate root, and that's the mesial root split sagittally. There was quite a bit of tissue still in the root. That's the distal root dehydrated with still quite a bit of tissue in the root. And then we're going to look at these under the SEM analysis. I'm going to show this as is our method through TDO. So we have 4 different sections, the 2 sagittal sections of the mesial root, 2 sections of the distal, sagittal sections of the distal root. In looking at the specimen, no bacterial morphotypes were found in any of the roots. So my supposition was that this was not a infected necrotic case, but probably a vital case. So let's look at the distal root first. I selected a couple of areas in each root because they're pretty much the same no matter where you look. So if you look at area 7, which is an area kind of in the mid part of the distal root, you do see some areas where there are some dental tubules, but most of this is just simply a standard kind of smear layer. You do see some dental tubules here, but it looks pretty much like the smear layer is intact, and there hasn't been a lot of demineralization, and quite a bit of red blood cells and either smear layer or instrumentation debris. So here you can see some demineralization of the predentin and a lot of red blood cells. So looking at an area along the side wall where you see this white material is dehydrated pulpal tissue. So this area right in here we thought would look there. And when you go in, this is what the dehydrated pulpal tissue looks like. Again, pretty much an intact smear layer. There hasn't been a lot of demineralization. It doesn't look like that's gone on. This is dehydrated pulpal tissue. Again, no bacterial morphotypes seen anywhere. And of course, a lot of red blood cells. Some dentinal tubules here, but most of the dentin is covered by this instrumentation or smear layer or pulpal tissue. This is all pulpal tissue here. So it's pretty much the same story no matter where we go. So I'm not going to spend a lot of time going through this. Here you can see some pulpal tissue, quite a bit of pulpal tissue here. So there isn't a lot to see from the perspective of what the device is doing. But it is worthwhile looking at these. This is where the pulpal tissue is charging up because I haven't coated it enough, but this is all pulpal tissue. And when you look at the mesial area, I'm not going to spend a lot of time on this. This is the mesial root. There was even more pulpal tissue in the mesial root, especially at the terminus. It almost looked like a pulpectomy had been done here. And this is all debris and pulpal tissue. So it is worthwhile looking at these just to get a sense of what these irrigation devices can actually do and what they don't do. Again, some dentinal tubules where the predentin has been demineralized, but also a lot of areas where it hasn't. So I hope that helps a little bit in the assessment of this tooth.